Hello, everybody. I'm Alexa Tinsley. I'm the Director of Programs here at Jett Foundation. Thank you all for joining us today on our webinar about pressure ulcer prevention. I'm going to give it another minute for everybody to hop on. But in the meantime, if you could please put in your name or your child's name and where you're located and you or your child's age in the chat, that would be wonderful, but only if you're comfortable, and we will be back in just a moment. All right, we will go ahead and get started. Again, I am Alexa Tinsley. I am the Director of Programs here at Jett Foundation. We are still waiting for Dr. German, so I think he's either having technical difficulties or time zones are not anybody's friend, and we know that. So we will give him a minute or two to hop on and see if he comes into our webinar today. But if not, we have Danielle Dwiggins here and Trina Stelly who will be talking about their experiences. Danielle is a nurse, but she is also a mom to a son living with Duchenne. And I think everybody knows Trina by now. She is a resource specialist for Jett Foundation. Her son, Austin, had Duchenne, and she also has a daughter who is living as a manifesting carrier along with herself. So we will go ahead and just start our intros. As you know, if you have any questions, please go ahead and put them in the Q&A box. We will primarily look at questions through there. We do try to look at the chat and monitor the chat for those questions. So if you do have one and we don't get to it, try to use that Q&A box. But if we still don't get to it, please go ahead and email us at info@jettfoundation.org. We can definitely try to get questions to Dr. German after the fact too. We'll try and schedule another webinar that he might be able to present on as well. So with that, I'm going to go ahead and Danielle, can you share a little bit more about what pressure injuries are and why there is such a concern around them?
So pressure injuries are basically injuries that happen at the pressure points, like elbows, shoulders, your backside, knees, heels, feet, that occur when you are basically either wheelchair bound, bed bound, and aren't able to turn and move around, and you're putting too much pressure on one spot for a long period of time, and it can cause skin breakdown, infection, open sores that can be very hard to heal, and just all kinds of things like that can just cause major long-term issues in addition to the struggles you're already facing with being wheelchair bound or bed bound.
Yeah, absolutely. And you know, the thing with individuals with Duchenne, especially as, you know, they become non-ambulatory, you have that loss of mobility, but you also have a lot of medications that you're on that can also increase the possibility of skin breakdown. So the risk for pressure injuries do increase with age and also mobility changes. So as you're, you know, considering what that looks like for you, as a family, just understand that while they may not have been getting a pressure ulcer while they were transitioning and in a wheelchair because they were able to move themselves a little more often, as you lose mobility, that might become different. So I am kind of going off of Dr. German's slides. So there is something called a Braden Risk Assessment Scale. So we can send it to you in the after of the email that we send with the survey, but it is kind of a way to see what your risk level is or what your child's risk level is for pressure injuries. So we'll send that to you so you can take a look at that. But that is definitely, it's not a foolproof way. Everybody's family is different. Every person is different. So just understanding kind of what you're looking for and what the risk factors are. Do you have anything to add to that, either of you?
Yeah, I was just gonna say, in addition to the breathing scale, like you said, there's various factors that can affect your risk for it as well as healing. So a lot of people with Duchenne are on steroids, and that makes you immunocompromised, which makes it more difficult to be able to heal wounds, as well as, a lot of others also have, nutrition issues related to, our medications, as well as, muscles fatiguing from chewing, swallowing, and various issues regarding that. And also just the need for protein as well, because wounds actually excrete a lot of protein when they get bad enough. So having that as well is really important.
Absolutely. And I think that, um, one of the ways to help prevent that is with movement. So, in the hospital, and I don't know if it's changed, but you would turn someone or move someone every 2 hours so that those pressure points and where pressure was located changed every 2 hours, because that's, again, not a foolproof method, but it definitely does help with a circulation, but also pressure not being on one area for so long and then therefore causing skin breakdown.
And even in the wheelchair, not even with laying down, you're at higher risk of different areas just based on where you're at in your wheelchair. If you're sitting and you have your elbows down, you can get skin breakdown on your elbows or even on like the side of your hand. With the braces that a lot of them have, like a lot of the guys have to wear, if it's not fitting properly, it can rub and it can create a sore that way as well. And just kind of thinking about positioning both in the wheelchair and in the bed. That's why you see a lot of the tilt in space wheelchairs. So you can kind of tilt yourself back. You're supposed to do that about every 30 minutes when you're in the chair, just to kind of tilt in different ways just to relieve the pressure.
Absolutely. And I think too, what I think I'd like people to understand is just because you start to see evidence of a pressure sore or ulcer doesn't mean that it's automatically going to turn into something more. There are proactive things that you can do to to make sure that it doesn't continue to progress. So just because you start to see it doesn't mean it's automatically going to get worse. You can definitely do things to help mitigate that. So I'm gonna go ahead and Trina. So for Austin, what kind of things did you do to help mitigate pressure ulcers?
So Austin did have an alternating pressure mattress, but I was still his turner, so I would wake up constantly throughout the night to turn him. When he was in his wheelchair, we would get something called lamb's wool, and we would order that on Amazon, and we would put it like on his armrest, and it just helped provide some extra cushion. He did have a like a Rojo mattress, not a mattress, a wheelchair seat that he would sit on. And Austin was really tiny, so he didn't have a whole lot of muscle mass. So he was more prone to pressure sores. And during his time on hospice, the hospice nurse shared some creams with us. And again, you can purchase these on Amazon. I'll show them real quick. And she showed us that you mix them together. So it's three different creams, and we would mix them together. And we found that it would actually help him heal a little bit better. And this one, let me see. It's a moisturize, and the brand is Medline Remedy, and it's a specialized moisture cream, and you'd mix that with an antifungal cream, the same brand, and a zinc oxide paste. So we would mix the three of these together, and when we noticed a pressure sore starting, we would use that. And if there was a pressure sore that wasn't quite healing, then we had special kind of bandages. And Danielle could probably speak to them. I don't remember the names of those specialized bandages that we would also use as well.
Yeah, there are a lot of different types. A lot of the more common ones, or they usually use like a calcium or a silver alginate, which is kind of like a fibery sponge, for lack of a better word, that you put on it. It helps absorb the and pull out kind of the bad gunk of the wound, for lack of a better word. It was really good for more like moderate drainage. Um,
Yeah, and I did pull up Dr. German's slide for pressure injury treatment. He says cleaning the wound daily, so twice daily with something called Venilex. Um, Also dependent on the stage, you can use different things. So offloading pressure, like we just talked about, barrier creams, moisture control. Because one of the things too is it's not just pressure that can cause pressure injuries. That's the fun part, is that it can also be caused by moisture as well. So making sure that those, folds and flaps and all of those things stay clean. So dressings in more severe stages, you look at wound vacs, sometimes surgery. But here are also some things. Mepilex is a brand name. You can use those. They have different ones for the elbows, the coccyx or the butt, and the heels as well. So those are shown here. I do also want to show the different stages that he has here. So you can see like redness to a little bit of skin tear to going down into the muscle, and then at some point you can sometimes see bone. So I did just want to share that so that you could kind of see those different options as well that what Danielle and Trina were talking about.
Yeah, and the cool thing with some of these dressings is, adhesive allergies are becoming very common. So they now make ones that have a silicone border instead. They make ones that are like silicone tape. So they're a lot more gentle on the skin, especially if you have that thin, fragile skin. You would want to use something like that because a regular bandage could easily just tear the skin and create even more problems.
Absolutely. One of the things that he mentions in here, if for some reason like there isn't a response to pressure changes, in terms of a pressure ulcer getting better, if there's problems with the wheelchair or the bed, um, or if for some reason they have a pressure injury and you're getting fevers, chills, drainage, any type of tissue discoloration, any severe symptoms, you want to make sure that you go to the ER and do see a wound care specialist at that time. I would honestly, if you have any type of pressure injury, I might encourage you, especially if there's a break in the skin, I would encourage you to, call your specialist or be seen by your PCP to see what you might be able to do to mitigate that and prevent it from getting worse. But one thing I'd love you both to talk about is, especially you, Danielle, is how it's not just pressure, but also nutritional deficits that can also help um, increase the risk of pressure injuries.
Yeah, so one of the things is definitely protein. That's the one we harp pretty hard on. Um, when I once researched chronic ulcers with a lot of drainage, it was saying a lot of protein is excreted in there, about 200% of what you are supposed to get in a day. So you have to increase protein intake, usually protein shakes. Um, like Ensure, they have also the Juven supplements as well are really good for that, um, especially with poor appetite. Um, Trying to think, like iron to help absorb the protein. And honestly, really any of the supplements that we're taking or that we typically take with Duchenne.
Yeah, and I think too, and I mean, we're looking at having a whole other webinar on nutrition, right? But I think nutrition is also a big deal in the Duchenne space as well. I mean, honestly, as normal, like as human beings who don't have risk of skin breakdown in our daily lives, I think that we all have issues with nutrition. So I think that looking at to see if your clinic has a like a dietitian or a nutritionist to help you figure out what that might look like as well. um, some of the causes that he has here, we've talked about moisture, so urine, stool, sweating. We just talked about poor nutrition. If someone has multiple infections, that help increase the risk. Certain medications, like we talked about, steroids, and then warmer weather. If you live in warm weather climates, sweat also helps increase that risk. I do want DJ did say, adding headrests because I think that's something we don't typically think about. You typically think about the bottom and the thighs and behind your knees and those pressure areas, your elbows, your feet, but the headrest, especially for those that are non-ambulatory. DJ, thank you. That was a really good point. Considering, making sure that you're taking the pressure off of that and moving that around and keeping an eye on, especially the predominant area, wherever the head is, to make sure that there aren't any skin breakdown in those areas, even with hair too, right? So making sure that you're moving the hair to look for those as well.
Oh, and to add, the BiPAP as well, having
Hmm.
around the ears, having anything in the nose. Another area I've seen that it first surprised me in wound care was on the shoulder blade. So those are definitely important things to look at too. I think his slide also has just a diagram that has all the pressure points are seated in the chair. I could be wrong, but that's always a
Yeah,
help just to kind of,
I think this is it, right? Can you
yeah,
see that, Danielle? Yeah.
yeah. And then it also on that slide shows, the pressure mapping, which is important. Unfortunately, it seems a lot of insurances don't cover that, but it basically is this mat that you sit on it and it'll see where your pressure points are. And then they'll make a customized cushion for you based on where your pressure points are. So it avoids the pressure as much as possible, which
Yeah.
is really helpful, but you also have to keep in mind it's not foolproof. So you still have to do the weight shifting as well.
Yeah, absolutely. And I think that, to this point is asking when you're getting an evaluation for a new seat or a new chair if this is an option. So again, Daniel, like Danielle said, it's not foolproof, but that doesn't mean it may not be helpful, right? So I did like here it says pressure release at every 15 or relief every 15 minutes. So I know that that's maybe not the most realistic option in our daily lives, but just keeping in the back of your mind, movement in any way, shifts in any way, those small shifts in movement that we do every day, that those that are non-ambulatory or transitioning may not able to do as easily, just considering what that looks like for your family to try to help prevent that. And then I think too, frequent skin evaluation. So, I mean, when you go in for those 6 months, I know that's not frequent. I would definitely consider more frequent than that. But just, making sure that someone's looking at those areas as well in those settings. And then he has, is it here? Yeah, so I thought that this was good too. So more treatment options and especially for those that maybe aren't able to use a urinal easily on their own, considering condom caths, if that's an option. I think Foley is not something I would recommend unless you absolutely had to go that route, but definitely something to consider if that's what you need at the time. Poise pads, thickening stool medications. But I think that you have to also weigh the stool thickening with also not wanting to get constipated either. So definitely think about what that looks like for your family. Um, but let's see if there's anything else that he touched on in here that I might be able to touch on. Um, Ooh, this one's good. Um, let's see. So also sharing, like Trina and Danielle were saying, those pressure seats and mattresses, you have the Rojos, you have alternating pressure mattresses. However, those are typically, at least the ones that turn you automatically, can be very expensive. So just, keeping in mind that we understand that piece. But we've also, I think at like both Cure Duchenne and PPMD, we talk about these things, right? And I think there was a specific seat that, was meant to help with pressure at Cure Duchenne that I saw. So definitely looking at options, leaning into the community to see what works for them and what has worked for their families, I think is really critical as well. Because, you know, mobility companies may make things that don't work as well as we think they do. So definitely leaning into others to see what those options have been for their families that have worked.
And I should add also, using other devices like a Hoyer lift, things like that, sliding, not sliding boards, but something
Transfer boards.
like slide up in bed, that you're not going to be like rolling and like the friction and the shear, um, with transfers and with rearranging in bed and everything. You definitely have to do things, have devices like that as well. And I see what DJ's saying about, things can go bad very quickly. I know we recommend people look at all their pressure points at least once a day, if not twice, just to make sure, because you could just be, I mean, for example, if you're not wheelchair bound yet and you're sitting in a chair for 2 hours, your butt is going to be sore from sitting in the same spot. And so just checking it, like things can change very quickly. If you're in pain after 2 hours, imagine how someone's going to be after they've been sitting in their chair for 12.
Yeah, absolutely. Um, Trina, do you have any, specific situations or stories that you would like to share in terms of like, I don't know, how you, if there was ever a situation where other than, the creams that you may have been able to, the story that may be able to help someone else.
So one time, after Austin became non-ambulatory and he was in his wheelchair, we live down south in a very rural area and we have a farm. So one time Austin developed this wound on the bottom of his foot, and we were at first thinking it was a spider bite. So I brought him to his pediatrician and we had it treated for a spider bite, and it just wasn't improving with the antibiotics. And then after seeing his neuromuscular specialist, we realized that it was a pressure sore from where his foot would rest on his wheelchair. So we got him like a little pillow to keep at the bottom of his footrest, and we were able to treat the sore before it became very badly. So I just want people to realize that at first you may think it's something else when it's actually the beginnings of a pressure sore. So that was something that we weren't expecting, and we had to deal with that. But luckily, we caught it in time, and we were able to add some more things to his wheelchair to prevent that from happening again. And then longer car rides were difficult for him, and even with his wheelchair seat, certain times of the day he required more air in his seat, and then other times, I guess it's like Danielle was talking about the pressure mapping. Depending on how he would move, he might have needed less air, and then if he moved back, he needed more air. So we were constantly adding air and taking air out to try to keep him as comfortable as possible when he was in his wheelchair.
I muted. Danielle, what about you? Are there any situations that you either personally or that you've seen in the hospital that you might want to share that might help somebody?
Oh, I've seen a lot, so I'm trying to think through. I mean, most of what I've seen predominantly is just people being up in their wheelchairs for way too long in the day. And also, I guess, just trying to find that balance of living life versus avoiding having further complications and issues with it. I'd say the other thing, the biggest thing I've learned working in wound care is that your PCP did not get any training in wound care. They don't really know what they're doing. They try the best and just kind of throw something basic at you and hope for the best. Sometimes that works, but especially with our guys, it's too important to have I know it's another specialist, but it's important to have that right person taking care of you and knowing what you're doing and understanding the factors that you're dealing with. And the other thing is really just, even wound care is just trial and error. Some things might work for some people, some things might not work for someone else. It's really just dependent on the person and their body and their health and, all those various considerations.
Yeah, absolutely. And then Any advice that you have? I know, first of all, you're not always able to be there, right? So, what kinds of things would you recommend that individuals, how would you, um, how would you encourage them to advocate for themselves if they're, in a situation where they feel like they need to be turned or they haven't been turned, and maybe mom or dad or sibling or whoever is typically caring for them isn't there? Um, is there any piece of advice that you have for families, especially in the stress of life, um, on this topic?
I mean, really, I think it's about also having the preventive equipment, like the alternating air mattress. Even if, sometimes these things are just so expensive, but the cost, the benefit outweighs the cost, hands down. Unfortunately, not everyone has the best of support systems. And so part of that's, finding a backup plan of some sort, whether it's having the other equipment that might be more expensive but be better, hiring a caregiver for those couple of hours that someone's gone, looking and see what benefits you might have that you didn't know about, or what foundations might be able to assist you with, and just doing the research, which is easier, I know is easier said than done, because we say that about everything in the Duchenne community.
Well, I think that's where it's so important to lean on others, right? Because, sometimes it's just not realistic that you're going to sit down and do all the research. But I can tell you right now that if you go onto Facebook and you go in one of those groups and you say, hey, can you guys share, what's worked for you and what equipment's worked for you for pressure ulcer prevention, or, you know, pain management, or whatever that looks like, I know you're going to get a bunch of different answers. So there's your research, right?
Yeah.
Um, so I think that this community is, amazing in terms of helping each other. So definitely lean on each other for that. I had something that I was going to say and then I forgot what oh, we do have an equipment assistance fund as well. So if there is any equipment, I can't promise that will cover the whole thing. Our max grant right now is $2,500 for that program. It is a once per year application. However, we can help with some of those equipment needs that insurance may not cover, or the copay is too high. So as you're considering those financial needs for some of those pieces of equipment, please do keep us in mind. All right. I'm going to go ahead and open it up for questions. Does anybody have any questions for any of us today? And if not, that's fine. If you think of any questions that you wanted to ask to Dr. German, or you think of any questions for any of us after the presentation, I can definitely get those to Danielle and Trina. And I can get them to Dr. German and see if we can get those answered as well. I will give it another minute. But I do want to thank you, Danielle, for tuning in and being here while you're on vacation. Trina, thank you for stepping in at the last minute and being here and sharing your experiences. I'm going to go ahead and check Facebook to see if there's anything on there. Let's see. I don't think I've seen anything in the chat.
And I was going to just add,
Yeah.
I kind of started out with this whole idea with just people were posting on Facebook asking about wound care a lot. And I realized that none of the organizations had any resources or anything. And so I just started, messaging saying, hey, can you give me like a picture of what this wound looks like? I can give you some basic advice, or basically let you know if you should basically go to the doctor or need a specialist, or what you could do in the meantime. I have helped a couple of families heal wounds and things like that. Or just give them just kind of assistance and recommendations of products, or just previous things, like, sorry, the messages keep popping up.
No, I
But
get it.
send me anything. I can't really judge something unless I get a photo to actually see it. Let's see.
Jessica, yeah, she did. I do have pictures. They are graphic, so if you don't want to see anything graphic, please do look away. But these are an idea of what the different stages are. So you have stage one, which is redness. So Ember, to answer your question, you know, even that little bit of redness can mean that it's on its way to being more serious. You have stage one where you have a little bit of skin tearing, right? So you're still not really down to the muscle yet. And then you have stage three where you're getting more into the muscle, stage four where you're getting down to the bone, and then unstageable. Um, Danielle, do you want to give a little bit more context on what unstageable means?
So unstageable means that, you see that stuff on top that's called slough or slough. You basically you can't see what the true depth of the wound is. Usually with something like that, if it's something more moist, they'll typically do what they call debridement, where they basically kind of clean it out with like different tools. Basically, they're just kind of cutting out the bad stuff. So the whole point of wound care, the whole goal is from healing it from the inside out. Because if you get something healed outside in, you're creating a whole pocket that can get infected. So that's also why it's important to clean, because eventually the slough will kind of start coming off. And so you have to clean it really well because that'll clean that off eventually. But there you definitely want to get in to see a specialist as soon as possible.
I think you want to stay away. I mean, you want to stay away from any of it, but honestly, once you start getting into these,
Yeah.
you start getting into like more aggressive treatments. So that's why, like Danielle said, making sure that you're checking daily those pressure points and like, DJ said, the headrest, all of those places where there's a lot of weight being put onto one space so that you don't get into these areas where you're starting to get down into the muscle and then, have those things like surgery and other things. So that's why, Danielle, you know, came to us because pressure ulcers are preventable, right? They absolutely are preventable, but they are very serious, especially once they get into those later stages, because it can cause infections. It can cause like it you just, if you can avoid getting into those later stages, just please do with those the pressure offloading and those checks daily if you can do it. If you're rolling your child in bed, or if a caregiver is rolling your adult in bed, just doing those checks then, right?
Mhm.
While you have them up, just doing a quick check and seeing where we're at. And then on the other side, doing the same thing so that you can do those checks as you're just, doing those daily routines. And I think one of the coolest things I learned, where were we? In Hershey, when we did our workshop, she was talking about how you incorporate stretching just into your daily routine when you're changing and doing the things. And I think that this is something that you can do the same thing with, right? Is making sure that you're making this part of that daily routine when you're just turning and doing those normal life steps. I'll go ahead and have Trina send those creams that she used in a follow-up email as well. Um, but does anybody else have any other questions? Oh, DJ says another clue, especially for the bottom, is small white bumps on the skin. They can be pus-filled at times. So, from someone with personal experience. Awesome. Well, thank you all again. Again, if you do have any questions, please feel free to reach out. We appreciate you all being here and joining us today, and we will see you soon. Our next webinar is coming up July 29th. So it is not a Thursday, so keep that in your calendar. We will be talking about GI issues with Dr. Kent Williams, so please be on the lookout for that one. And we hope you all have a wonderful day and see you again soon. Bye, guys.